Next, we're going to hear from Taylor Musil, who is EHP's field manager. Taylor earned her Bachelor of Social Work from Calvin University and her Master of Social Work with a concentration in community, organization, and social action from the University of Pittsburgh. One of the newer members of our team, Taylor is focused on ensuring that community priorities and concerns are centered in our efforts to address public health risks in unique situations. So take it away, Taylor.
Great. Thank you so much, Allison. Again, my name is Taylor Musil, and I'm EHP's field manager. And really, I'm honored to be in the presence of, such a wide array of partners interested in protecting air quality across New York. And, as Nathan just described, there's a significant information gap that local communities face when identifying and assessing their local level of exposure to fossil fuel pollution. And so our organization aims to equip residents and decision makers alike with the data and research they need to raise awareness of local pollution concerns and health protective actions at both the individual and the system level. So I'm going to provide a brief overview of some sets of tools that EHP has to offer to help measure air quality and protect public health, with the hope that at least one of them will be applicable to you and your work and your community. Along the way, as we've been saying, please share any questions that may come to mind in the chat, and I'll try to answer as many as we can that time allows afterwards. Next. So our tools fall into three categories. First, data collection and analysis, which focuses on community air monitoring networks, pollution modeling, and analyzing pollution patterns and sources. Second is our health and wellness education tools, which are probably what you would think of: handouts, toolkits, other materials that raise awareness of the public health concerns associated with oil and gas development and share steps that folks can take to protect their health. And third, policy and advocacy resources that leverage science and local data to support health protective measures. Next, please. So for data collection and analysis, understanding local air pollution is critical to understanding your health risk and your exposure levels at an individual and community level. And so these tools focus on providing community-specific information that informs solutions tailored to each place's unique context. And we accomplish this primarily through low-cost monitoring networks that record levels of, the particulate matter and the volatile organic compounds that Nathan mentioned earlier, both that are, of course, associated with shale gas operations. And so real-time data from these networks are available through, the publicly available Purple Air map that you see here. This is actually just from this morning. We also like to take a deeper dive into the data using an EHP original tool called AirView. And so, there are two uses here for Purple Air. A lot of times it's answering questions like, will I go for a walk today? Or will students go outside and play for recess? And AirView is meant to be more of a deeper analysis of pollution trends and risk assessments by integrating other data sets with that low-cost monitor data. So since 2014, on the right here, you see a map of New York, and there are 13 counties where we have done monitoring engagements, around 12 compressor stations and 2 gas-fired power plants. Next, please. So our AirView app is an online platform that has been iteratively designed with feedback from partner communities about what would be most useful for their efforts to protect ultimately their neighbors' health. The tool has 3 primary uses. So first, exploring air quality trends across seasons, weather patterns, and times of day. And second, measuring exposure levels and comparing pollutant readings with federal air quality standards, as well as monitors in the same community and other EHP monitor networks. The graph you see here is from actually summer of 2023 and shows the 24-hour average of PM 2.5 readings within this community network. We're trending along with one another, but then also showing 2 exceedances of the EPA 24-hour standard. Thirdly, AirView can assist with event source identification through wind speed and direction analysis. So essentially, from where is the wind coming and at what speed when a monitor has its highest readings, as well as high split pollution dispersion modeling, estimating the path of pollutants towards an air monitor. To ensure that local air quality data and our analysis tools are meaningful to community members and their local efforts, we created the Environmental Health Watch model. So this is our flagship community engagement program that helps communities better understand the local impacts of shale gas development and equips them with info that they need to protect their health and advocate for stronger policies to stop the expansion of shale gas facilities and hold operators accountable. So this Health Watch model has several key components that we'll share here. So first is, of course, the monitors themselves. Second is access to the AirView app. Third is training sessions, as well as air quality reports, health education materials, and community meetings to share findings and recommendations. And we're excited to announce that we are gearing up for a new cohort of Health Watch this summer, and we are accepting up to 3 communities into this cohort, and we'll share the application link and the fact sheet here. So if you yourself are interested in applying, or you know a community organization that would benefit from a program such as this and has, you know, existing or proposed shale gas infrastructure like a compressor station or gas-fired power plant, these applications are open until May 15th. So our second set of tools are related to health and wellness education. We have an extensive fact sheet library that offers materials of all kinds, from general information about health harms to audience-specific or issue-specific handouts. And so one of these more specific tools we wanted to highlight is our Health Professional Toolkit. This toolkit helps health professionals of all kinds be up to date with information and research on the impact of shale gas operations on their patients' health. And after completing this toolkit, the goal is to have health professionals feel confident in their understanding of the existing research, recognize potential impacts on their patients, and then be able to provide resources and recommendations for those who might be impacted. So our third set of tools is around policy and advocacy, and this includes policy statements and recommendations to assist with policymakers as they, hopefully integrate public health into environmental, zoning, and energy policies. You'll see here one of our position statements on setback distances, and really central to our policy approach is following the lead of those most impacted by this air pollution and pollution generally. And we wish to be a partner in research and analysis, serving the priorities of the communities who know best what they need. So my last slide is just to, of course, remind everyone of the upcoming breakout sessions that will align with these 3 different sets of tools that I just covered. And, I hope you will stick around for these discussions and dive a little bit deeper into each of these topics. And I'm happy to answer any questions now that may have come up.
Thank you, Taylor. We do have a question from the chat. For Health Watch, is it only for organizations or communities that have shale gas infrastructure? It looks like there are a range of facilities within this community that might be interested. Yeah.
So when we talk about shale gas infrastructure, we mean the whole life cycle. So not just, explicitly someone with, a well or specifically a compressor station, really the whole life cycle from extraction all the way to transportation and waste disposal. And so we're definitely open to talking to folks that are anywhere on that life cycle and, see this as all interconnected. So yeah, that's I would be happy to talk more offline about that as well.
Great. And are there specific requirements that a community partner needs to meet for eligibility in the program?
Yeah. So typically what we ask folks, and I think this is even asked on the application, is, about the availability of either a supporting organization or a community volunteer who is able to help with some of the on the ground, putting up these monitors that are fairly easy to install, but certainly require coordination in order to get into people's homes and make sure that everything is up and going, as well as assistance with outreach to try to make sure that we're communicating this information effectively to community members. So typically what happens there is there's 2 point people, which one person could play the same, both of those roles, one being a technical liaison, another being a community liaison. And we found that in past cohorts, it typically took about 40 hours per year for each of those positions to help have a successful program.
Great. And finally, you said you're happy to chat more offline. What is the best way for someone to reach out to learn more about the Health Watch program and this upcoming cohort in New York State?
Yeah, absolutely. So there's the application, of course, is the most direct way to let us know you're interested. And then I can also drop my email in the chat. I'm happy to answer any questions or have a conversation after this webinar about that program.
Great, thanks, Taylor. And I think we have time for one more just came in the chat.
Yeah.
There's a question about monitoring particulate from other types of activities such as asphalt production.
Yeah, so typically we just monitor, like I said, for PM 2.5 and total VOCs. So I can't speak directly to this, I think, as thoroughly as I would like to, but I am either happy to get more information or if any of my other colleagues want to jump in here. Yeah.